Hello, my name is Drake Baston. I am a distance learning student with Indiana State University, and this is my community health project for my community health nursing course 444, and my topic today is children and adolescents with severe sunburns are at increased risk of developing skin cancer later in life. My learning objectives are: define what a sunburn is, describe other harmful sun effects aside from the skin, understand what the risk factors for age groups are, describe types of skin cancer, describe how to prevent sun damage and burns, understand the importance of frequent skin checks, and describe how to treat sunburns if they occur. Now I have a 10-question pre-test. If you would like to pause the video and go ahead and take that test before we get through the rest of the program. Okay, now that you've taken the test, we will go ahead and proceed. First of all, what is a sunburn? Ultraviolet rays from the sun beams onto the planet that are not noticeable to us, yet that is what causes the pigment in our skin to change, thus causing a sunburn. Melanin, which is a chemical we have in our skin, causes the pigment reaction with the UV light, which causes the skin to turn colors, tan, and into a burn as well. The lighter the skin and pigment, the less melanin protection a person has, which causes someone to burn quicker, which is why people that are more fair-skinned have a tendency to burn faster than people who have darker skin. Other harmful effects from sun exposure. The sun can also cause damage to our eyes over an extended period of time, which can lead to cataracts, aging of the skin, such as wrinkles from cell damage. Also, the immune system can be harmed from the sun from extended exposure to the UV light. And cancers involving the skin, of course, are also a major concern from exposure to the sun. Risk factors for children and adolescents. Infants 6 months or less have less protection from the sun due to lack of melanin in their skin. It is just not developed yet if they're 6 months of age or less. Children who are severely burned puts them at a double chance of developing melanoma later in their life, and sunscreen is not applied properly with many children, which also increases their risk of developing a burn. And playing outside, as kids often do, is overlooked for sunburn risk, and sunscreen is not applied even when when the kids are outside playing, which is another risk factor. I have listed some common skin cancers. Basal cell carcinoma is commonly diagnosed, but also has a good prognosis if found early and treatment is promptly given. And then melanoma is very deadly if undiagnosed and untreated, and 5-year rates of survival are 99% likely to survive if found early and treated early, 66% out of surviving if minimal involvement to the lymphatic system, and 27% of surviving with late detection to multiple areas of involvement of the lymphatic system. So melanoma tends to involve lymph nodes, and so once it's spread to multiple nodes, it's considered metastatic, and treatment options are not as available and do not work as efficiently. Therefore, proactive and preventative treatment is key to combat this concern. According to the American Academy of Dermatology, out of 5 Americans, 1 of us will have some form of skin cancer in our lifetimes. Prevention. Prevention is key. Skin cancer is known to be the most preventable type of cancers of them all, according to the American Academy of Dermatologists. Sunscreen used daily with an SPF of at least 30, and making sure it is broad spectrum and resistant to water is best. Frequent application of sunscreen for swimming and sweating and long hours of sun exposure is also recommended. and avoid being in direct sun and find shade when possible. Wear clothes and hats that protect the skin when able, such as to protect the scalp. Also, you can use umbrellas and tents if you're outside sporting events or at the beach to protect yourselves from the sun, and use the 10 to 4 rule of avoiding sun exposure when the UV rays are the strongest at those time of days. And also, don't forget about the eyes with sunglasses. Get sunglasses that have 100% protection from the UV light, and that will help prevent sun damage, and that can lead to skin cancers later on. Another important prevention and screening technique is skin checks. Checking the skin of kids is important for early detection of suspicious skin conditions. Areas of concern can look like a bug bite or a wart that often affect kids. And checking areas that often get missed, such as the palms of the hands and soles of the feet, are important areas not to forget about. An easy tool that can help parents is provided. There's a PDF that you can search, which is the ABCDE rules for skin checks, and it's called How to Spot Skin Cancer, and it has some really good visual and pictures and information on how to check the skin properly for areas of suspicion, and I think it's a really good site. So I wanted to put treatment of sunburns in here as well, just because we all have, I'm sure at one point in time, and have all had a sunburn, and our kids, if you have any, will eventually probably develop some sort of degree of sunburn. And so treatments are recommended as providing a cool water or bath for a sunburn, not cold water or hot water, applying aloe topically to the skin. You can use medications such as Tylenol, Advil, and Benadryl. Tylenol is for the pain. Advil would be to help inflammation, and Benadryl to help with any itching. Lotions to increase the moisture to the skin and apply as often as needed. Also avoid actually no sun exposure after a burn at all. Seek medical attention for any blistering, if a child has any blistering with a burn, and avoid opening blisters, so don't let the child itch or pick at blisters if possible for risk of infection. And do not use Vaseline or petroleum, which Vaseline has in it, on the skin, because it actually suffocates the skin's natural barrier and ability to breathe in a natural way. And check for any possible interactions with medications like antibiotics, because it can increase, potentiate burns from sun exposure if you're on antibiotics. And do not ever give children aspirin. In conclusion, everyone is at risk for sun damage, including skin cancers. However, children are most vulnerable to burn due to their lack of knowledge and ability to provide themselves proper protection. It is important for adults and parents to provide the protection to children and to educate on the effects of sun damage and burning. Educate adolescents on artificial tanning risk, practice recommended sunscreen use, and lead by example as an adult and a parent to children that support safe sun exposure habits for a lifetime. For more information, I have provided a couple other websites for sun safety. Here are my references. Thank you for viewing my presentation, and don't forget to take the post test at the end of this. Thank you.